So let's talk about the stakes of burnout. What's at stake if we don't address burnout, um, particularly in our systems, in our healthcare systems in the US, particularly. So we'll talk a little bit more about what it means for us individually later on, but what does it mean organizationally as a system? What are the stakes? What if we don't address burnout and the causes of burnout in healthcare? Well, there's a really interesting, actually, two reports now that have come out, one in 2020 and one in 2022 from the U.S. Surgeon General, Dr. Vivek Murthy, who talks about the impact that burnout is having across the board for healthcare workers. One of his conclusions is that we're going to lack physicians. We're going to lack nurses. And so he actually put some numbers to that. He believes that by the year 2033, which is obviously not terribly far off at this point, that the shortage of physicians will be between 54,000 and 139,000 physicians. So when we think about access to healthcare right now can be a problem for many people in the United States. When we think about the number of physicians dropping over the years precipitously, obviously that is going to be more of a problem. When we think about nurses, these nurses, the one study that we mentioned in a previous video that talked about how 92% of acute care nurses said that pandemic would shorten their careers. Those nurses, even if not all of them are right about that prediction, even if only half of them are right, means that they won't have the same longevity in their nursing career than they would have otherwise. So they're going to start to disappear. If we don't address moral distress, moral injury, and burnout, simply put, there's going to be a lack of access to healthcare for our communities, for our fellow citizens, for our neighbors, our parents, ourselves, our children, and the people that we care about. So that's some of the quantity that's going to change. Let's talk about some of the qualitative things that are going to be impacted if we don't address burnout adequately. First of all, we're going to experience decreased patient satisfaction. We know that burned out coworkers are less engaged, and less engaged coworkers typically have the result of lower patient satisfaction. So that matters a lot as far as our metrics and our goals as an organization. Maybe it even matters as far as bonuses and incentives, but it really matters when your mom's in the hospital, right? It really matters when you're in the hospital. It really matters when your brother's in the hospital. And then you realize my mom's being taken care of by people who are burned out at this alarming rate, meaning that they're not fully engaged with the care they're giving, meaning that my mom's going to have a different experience when she's in the nursing home, when she goes to the doctor's office, when she's in the hospital. The impact that has for us personally when our loved ones are in the hospital or we're in the hospital or a nursing home or other healthcare facility is really profound. We know that burnout is associated with a lack of empathy. If I feel burned out, and we talked about that depersonalization and cynicism and empathy do not go together. And so if I'm feeling cynical, if I'm feeling disconnected from myself and from those around me because of my burnout, my empathy is going to be less for the patients, for the residents, for my coworkers, and even for myself. That's going to result in errors. And so we're going to have higher costs. So there's actually an ROI for sure, the multiple ROIs impact on the return on investment, what it means financially for our coworkers to be so burned out, and the impact that's going to have on our care, because we all know that errors are costly, not just for the human side of things, but even for the financial side of things. PTSD is a studied and documented impact of moral injury, particularly that vicarious trauma, when we're watching people go through things they shouldn't have to go through, the way that impacts us, and sometimes that lack of psychological safety. We know depression, anxiety, these things are things that crop up qualitatively for us as we face burnout. Absenteeism, talk about a bottom line issue, right? When our coworkers are burned out and they're feeling all this stress, they're much more likely to call off and not be available for those shifts, and that impact is really significant. And then the darkest and heaviest impact qualitatively, of course, that burnout can have, and you already know this, is suicide. when we feel disconnected, when we feel overwhelmed, when we feel unsupported in life. But of course, particularly we're talking about at work right now, suicide becomes a much greater risk. You may already know that the occupation in the United States that has the highest suicide rate is the occupation of physician. And there's lots of reasons for that, lots of speculations about that. But we know that physician and nurse are sort of the central line of the healthcare system. And so if one of those disciplines is at the very top of industries, occupations in the United States where suicide is happening, that should ring the bell of an alarm for us, and that we've got to address the symptoms of not feeling psychologically safe, of being burned out, being in these moral injury sort of situations.